administrative items. First, we have a few members joining us remotely today. Just trying to see who we have here and if they could announce the fact that they can hear us. Judge Pagano.
I can hear you. Thank you.
Sheriff Sanders.
I can hear you. Thank you.
All right. Ms. Love.
I'm here. Thank you.
Mr. Corson.
Yes, present. Thank you.
Okay, great. And I think that does it. Also administratively, we did have an executive session yesterday to cover certain personnel matters and matters of public security. And with that, we'll move on to the first of two rounds of public comment. As usual, the first round is intended for items that are specifically on the agenda for today. And there is another one at the end that would be for any sort of matters associated with the jail. If there's anyone here that would like to address the board, please do so now. All right, hearing none, we'll move on to an approval of last month's minutes. Is there a motion to approve?
So moved.
I'd like to make a motion to approve last month's minutes.
Thanks, Reed. Is there a
Second.
second? We have a motion, a second. Any questions or comments on the minutes? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. Do we have a motion to approve the July reports?
Make a motion to approve the July reports.
Thank you, Controller Phillips. Do we have a second?
Second.
Motion is second. Any questions or comments on the reports? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it. Moving on to the Executive Director's report for this month.
Yes, I wanted to mention a few things that we are working on in our office that will impact the facility as well as the employees in the facility. One is that we are nearing the finalization of our employee handbook. I know that's been of interest. We have an update from our new director. It has been under legal review. We are fortunate that we had a solicitor added to county employment who has specialized in employment issues. So having another final review, we had hoped to get this out to people sooner. But those reviews have really been valuable and we think make a much better and clearer product for all our employees. The expectation is that document will be out and released for all our employees next week. We will be asking that there be an acknowledgement form so that employees can get physical copies for the facility. We know many people don't have access to a computer, so even though it is online, we will be providing hard copies. So it may take a little bit to get the hard copies out to people, but we want to make sure that everyone has a physical copy of the handbook and have a document that acknowledges that they have signed and received the handbook. So looking forward to getting that out to people. Secondly, we have asked the Human Resources Department to provide the Jail Oversight Board with reports on a monthly basis on personnel issues within the facility. We know that it's important to make sure that we as a Jail Oversight Board are fully informed on the vacancies, the types and number of disciplinary actions that are happening, the reasons that people leave the facility. That's something that we are very interested in, making sure that we understand that we're supporting the facility and the administration there and making sure that we have a quality workforce that we can retain and that our employees are being treated appropriately and the discipline is being applied properly. So we will be looking at that information on a regular basis. We won't be able to share the results of that or the reports, but just wanted people to know that that is something that we are working on getting more information and looking forward as a Jail Oversight Board of digging into that information and again, supporting our administration and workforce in their effort to have a good quality, fully staffed workforce there at the facility. And then finally, I wanted to mention we are working on some more employee engagement issues at the administrative level. We'll be providing more information to employees in terms on a monthly basis, having a virtual meeting on different topics. Our meeting in September will be focusing on the workday. I'm looking at Controller Phillips because that is a big project of hers, a workday software that is going to provide great flexibility for employees, information for employees. It will include an HR module where people will be able to see and track their time off, their pay stubs, It will also enable us to do better in terms of purchasing, HR recs, our budgeting, and tying together a lot of all the important work that we do and making it easier and more effective for the county, being able to provide reporting. But again, from the employee perspective, having a good HR module so we can actually be able to fill positions faster, but also give employees their own access to their own information that they can control. So very much looking forward to that implementation. Again, we'll be having monthly sessions on a variety of topics. They will be filmed and saved, so they will be available to people online. We also created a virtual suggestion box where people could provide suggestions. I will be looking at those suggestions. They can be submitted anonymously in a facility like George W. Hill. We know, again, that not all the employees have access. So I will work with the executive team to figure out how we can have a form or some way that employees can complete that either virtually or in paper format. And then it will not go to administration there, but go to, again, the executive director, as it does in all county departments, so that those employees as well have access to making suggestions. And then also be stopping by all of our satellite offices, including GW Hill, on a monthly basis, making sure that I go out, see the facility, meet people, and we'll make sure that we have the schedule for everybody. I'm sure I will be out to GW Hill as a member of this board more frequently than that, but want to make sure that we see all of our employees across the organization and all the different facilities that we have. So just wanted to give those updates, and looking forward to working with the administration on some of the items that I had just mentioned.
Thank you, Director O'Malley. All right, moving on to the warden's report. Warden Williams.
Good evening, board, and all those that might be observing either in person or virtually. We will be going through the report, but Sean will have to manually advance for myself and everyone else due to not typical me issues, just technology issues in general. So we'll start with our monthly statistics. Our population as of this morning was 1,193 incarcerated persons, which is actually a decrease from last month's meeting that was 35 more. We had 10 individuals as part of the Weekenders program, 7 of those being first timers, 2 females. Recreation, you can see, was offered as full recreation, except as otherwise noted. We typically do attempt to get individuals out as much as frequently possible. In terms of major incidences, we had a few in the month of July. There were several periods of high 70 to low 80 degree weather within the housing units. When we had those, we were making sure that the Jail Oversight Board was informed, as well as the plan of action to restore units to functionality. We've talked a bit about HVAC, but it's important to note that with the heat wave that we were experiencing, that was something that was a great challenge within the month of July. We did have a stabbing incident on 7 Delta. The individual who was victimized was stabilized on site with healthcare team and was able to be treated and restored back to general population. That case was referred to CID. We did have phone and tablet outages for approximately 48 hours. That was on 7/12, which would have impacted individuals being able to contact their family members for quite a bit of time. That was a problem that was worked on both by Verizon as well as Viapath, who is our tablet and phone organization. We had a patient that had a critical illness event on 7/18, in which CPR was initiated on site, and we did have to have the individual emergently transported to the hospital. And then on 7/19, even though I feel like the entire nation talked about CrowdStrike for a while and then moved on, I felt like it was important to bring that up because while airports were grounded for the entirety of the day, institutions such as George W. Hill and other correctional agencies don't have a choice. And we had Shift Commander Lieutenant Amanda Librano, as well as Shift Commander Lieutenant Saleem Jones, who had to keep the building fully operational, intakes, outtakes, releases, courts, collaborations with the Sheriff's Department, and all the other stakeholders within Delaware County. County IT worked diligently. We had our own on-site IT, Brian Held, who had most of the institution operational before most of the nation was truly operational. And we had a number of different departments that really found a will and a way to make sure that services were not disrupted. And so an enormous thank you to the entire agency and institution, but specifically to our IT department, our booking and records department, our healthcare department, to make sure all medications were administered, even though they were limited with electronic medication administration records, as well as our shift command team for making sure that we could still operate. Our monthly statistics in terms of census remains pretty consistent. As you can see, those trends don't typically change. We still maintain a predominantly male facility, always will, and the majority of our individuals are pre-trial, meaning that they are going through their adjudication process. For our age trends, we're staying consistent. Again, those have not changed. Neither have our race and ethnicity trends, but it is important to make sure that this information is published out and made available. We also share this demographic information with several other criminal justice stakeholders in Delaware County. Data can be useful, though it doesn't always paint the entire picture. It does help guide additional conversations and talk about who is represented within the facility. In terms of our new commitments, we typically do also collaborate with probation department to fact check numbers. In the month of July, we had 515 new commitments, and you can see that the lead commitment reasons driving those coming to the agency were aggravated assault, domestic relations, DUI, firearms and weapons charges, failure to appear bench warrants, possessions or drug paraphernalia charges, receiving stolen property, simple assault, and violations of probation. Violations of probation still leads those committed to the agency. It was 115 within the calendar month. Nearly 23% of those coming in are violating probation. Important to note that 2 of the individuals that came in were actually violations of state parole, though it is frequently categorized the same. In behavioral health statistics, we did see some changes in a drop actually with those with any mental illness. It was a pretty significant drop, which is why I find it notable, and also had those with serious mental illness in terms of our new commitments coming in, as well as our population. So we've had a lot of different changes within the population over the summer months where we were climbing, and it looks now that we're starting to drop within that population. Some have also been transferred to Norristown State Hospital, which also reduces the population. So they're still forensically involved. They may just not be within our current institution.
Ward, is there anything further you can ascertain as to why that spike during the summer months and kind of reverting back to, well, actually dropping below it was in April?
Honestly, I mean, I could speculate. Many of us think that during the warmer weather months, disorders like seasonal affective disorder or bipolar disorder sometimes cycles where you have periods of increased mania during the winter or the summer months. Some would say that there's just more activity and people are out and they're engaged. I don't know. There could be a ton of theories, but we did see a drop, which is significant. What I can say is the persons that we have in custody with serious mental illness are still really requiring additional resources and treatment. So even though there might be some respite in the numbers, it doesn't necessarily equate to the workload for persons that are requiring that care. We've also been able to make pretty significant effort toward, and I know over the last 2 months, we did discuss this publicly as well. WellPath had unfortunately lost the CLIA waiver and the lab license due to an error that was made. There were no performance functionality issues. It was a clerical error that ended up having a pretty cataclysmic effect. But we have been able to restore that as an agency, which has impacted in a positive way our medications for opioid use disorder treatment. So in July, we had 172 individuals within our population that were participants on some form of medication-assisted treatment. 155 of those were continuations on a medication, and then 17 were inducted actually within the last week of July. So as soon as those certifications were restored, we resumed the induction process Our healthcare department worked very closely with booking and records to try to identify persons who were on the wait list within medication-assisted treatment who might be up for release very soon, to prioritize those individuals, to get them involved. And then they were also working on the longest waiting persons. We think that we're going to be able to really move through the list, though we may not be able to meet every single person because the demands are so great and the turnover or attrition within a county facility is very different. We definitely think that we're going to be able to make pretty significant strides into meeting these populations' needs.
Warden, I think, in terms of areas where sometimes we struggle with staffing, and I realize this is one where we're utilizing a third party in WellPath. Anything that you can speak to in terms of improvements or ability to improve in the staffing levels in that area?
So we've applied for 2 grants that we had spoken about over the last couple of months. We're awaiting to determine whether or not monies will be allocated. If so, we may be able to actually hire additional staff, and that's part of the grant proposal. We've discussed this before, but I think it's worth reiterating. We have 1 nurse, 1 advanced practitioner, it's actually a physician, and 1 MAT coordinator who has been spoken about, highly Demetrius, who is managing a large population of individuals, which is not sustainable for 3 people. We really do need to increase the complement. So WellPath has been a good partner in giving us ideas and proposals in terms of staffing matrix. It's finding funding to be able to do this. So I think we can move towards something even incrementally to increase capacity and hopefully be able to share some of the responsibility within this department.
Yeah, and look, I think this is where the budgetary rub occurs, right? I think you have, and we're going to talk about it in terms of capital improvements. That is an area where I think it's easier to understand when you have a facility that's been underinvested in for 25 years and you're talking about issues of security. I think it's easier for the public to understand why these investments have to occur. I think when it comes to these investments in staffing, I think it can sometimes be a bit more subtle for the public, but this is really where the rubber meets the road. When you find opportunities to make these investments to ensure that, what we've talked about in terms of MAT and treatment for people dealing with addiction or mental health issues, it does cost some money unless we can find some grants, which I hope we can. But it has that, snowball effect of impact where you're improving outcomes for people, hopefully reducing recidivism, you're improving public health. This, all roads kind of lead to the county jail element. It's, these are dollars, but they're important dollars to consider spending.
I don't know if I could say anything better, but I agree in that the county has adopted philosophies that I think are moving certainly in the direction of many other neighboring cities or jurisdictions, but they do come at a cost. We remain committed to finding whatever funding sources we can before requesting additional funding from the county. But jails across the nation are an expression of what needs are not being met in the community that may be funded at other sourced levels like the federal government or state funding. If those accesses to care, treatment, resources existed without barrier in the community, people would likely not find themselves in agencies like George W. Hill.
Yeah.
But when they do, this is what we're attempting to do to meet those demands.
Warden, is there any discussion between that with the health department that any of that money, I mean, we're talking health, mental health, physical health, nurses, doctors, and staff that's, going through critical mental health situations as well. I don't know whether can be explored further, or I just have looked at them come for, at council meetings, and there seems to be money there sometimes for programs. I don't know whether there's any crossover for the jail at all.
And I think also we can speak to the opioids funds, right?
Yes. So to speak towards the health department, under the direction of Director Lyon, We have had a great working relationship. There is every opportunity that we look at something as to whether or not our population would specifically apply. And we have some upcoming conversations specific towards a program. It's called 340B. We are a participant already. We're trying to explore through partnership with the health department if there are even more opportunities to offset costs through that program, and that comes through the federal government. There are several other opportunities. Unfortunately, justice-involved individuals who are in incarceration typically don't meet the eligibility requirements for a lot of funding. And we can't offset costs by Medicaid or Medicare. So there are some real things that legislation unfortunately prohibits that allows us to really seek those funds, which puts so much of the burden on the taxpayer. But we are working on something right now, like I said, with the health department with 340B, and there is opportunity for some of the opioid settlement funds to offset a lot of the behavioral health programs that we are engaging in the facility because we're providing services that may not, that are meeting demands and needs that are not being met within the community.
Thank you.
Thank you. So this is a slide that's got a lot going on, but it's an important one. Our employees of the month this month are Erica Marley, intelligence analyst, Khalil Andrews, correctional officer, and they are actually not pictured. Jerome Moss, sergeant, he's in the lower left quadrant. But we also have several employees who have pretty significant years of service. The facility has been under the direction of CEC, Wackenhut, Geo Group, and the county even before those private entities came in. And then once again, we are making an effort to make sure that we recognize years of service in the agency. And we did start doing that this month in a more formal way. So you can see that we have on the top right side, we do think his dates might be a little wrong, that maybe we missed 2 years with one of the private firms. But one of our case managers, Godfrey, we recognize for 22 years, but we think he has 24, and he received that on August 1st. We had 3 individuals that you can see pictured that share an anniversary date. Chaplain Kukilia Dunn achieved 14 years of service on August 9th. Officer John Manata, 25 years on August 9th. And then Officer Lamont Watkins also received 25 years on August 9th. Not pictured because we just didn't get those pictures. We have Officer Osai, August 7th. He has 18 years of service. Officer Moore on August 10th, 11 years of service. And then 2 upcoming to round out this month, Officer Richard Wells and Officer Ronald Stansel also have 25 years of service on August 30th. So we wanted to make sure that we recognize that because we do have a lot of long-term employees who have remained committed to the agency, even though it has not always been easy to do so. Last month, we were able to highlight that we had this opportunity with the National Institute of Corrections to provide crisis intervention team training. That training was a 40-hour commitment. It happened between July 8th to July 12th. We had 23 participants from our facility, and well, it was 21 from our facility and 2 from Berks County that participated in the training, represented by nearly every single department within the agency who received training and instruction from psychologists, mental health professionals, as well as individuals, all who have previously worked in criminal justice agencies, county jails, and state facilities from across the nation. It was a pretty extraordinary week. I think that everybody who participated saw the benefits within the program, and they were able to share a lot of their experiences with some of the challenges facing them as employees in a criminal justice agency, as well as the population that we serve. Crisis intervention is something that's adopted by a lot of different law enforcement agencies, but is particularly leaned upon within the corrections field because we are working on making all interactions with our population as safe as possible. And coming to jail in and of itself is typically an enormous crisis in somebody's life, even if they are emotionally stable. So we went through many different role plays and scenarios. You can see the teams doing brainstorming exercises about how they might be able to implement some of the skills that they learned throughout their training. We need to make sure that we extend a great deal of gratitude to MVP Recovery. So Brian Corson, who I know is on this meeting and allowed us to visit MVP Recovery, and also sent certified peer recovery specialists to speak to the class about some of their experiences. It was a very moving experience in general, and helped to really formulate a lot of the concepts that people were learning. We also had Steve Deaver from the Office of the Public Defender speak about involuntary commitments and the Mental Health Procedures Act, which is extraordinarily important and faces our agency and so many others. And then also Nina Chaichula, who is the psychologist in WellPath. She spoke to our personal processes in terms of mental health referrals, as well as medication treatment and other behavioral health interventions. In the bottom left corner, this was interesting statistics that was provided. Agencies that adopt CIT have a much higher retention rate. And so you see CIT certified officers, 80%, whereas officers or agencies that do not adopt these programs have a 50% rate of attrition. And so a lot of the skills that were learned and discussed is not just how we interact safely with the incarcerated population, but maintaining our own mental health, safety, stability, and prevention of burnout. So we have a very committed team. You can see the participants in the bottom right corner, many of whom I think are very anxious to start with meetings in the agency. I will be meeting with the National Institute of Corrections virtually next week as a kickoff, and then we'll start doing more routine meetings at the agency to begin policy review and schedule some additional trainings on site. In our training academy, we hosted one graduation on August 2nd. You can see the graduates in the picture. They were sworn in by Judge Macrates on the 2nd of August. They were very excited at their graduation and seemed to be a very tight-knit group of individuals committed to moving the agency forward. We have another class beginning next week, actually, and we are recruiting for our class to begin on September 16th. So anybody who is interested, we still utilize the applying function on our website that also links to the county website for any job availability within the county. We also celebrated our very first CERT Academy. So since the county transitioned, we have not run a CERT Academy. We had more individuals who had started and 4 who completed, really demonstrating an understanding of all of the training. This is in addition to their duties as a correctional officer, with more activated training related to de-escalation strategies as well as use of force. Our CERT team is our correctional or emergency response team within the agency. They provide additional backup to all of us in the agency when we might have an incident or distress that's needed. They are run by CERT Commander Officer Richard Wells, Assistant CERT Commander Instructor Damon Lodeholt, and you can see those 2 individuals on the far left. CERT Operator Officer Anthony Laughlin had an enormous hand in a lot of the instruction as well as the full academy. And our new CERT operators, you can see Officer Tarwilly, Artis, Scott, and Chroma graduated successfully. We will be, for employees who might be listening, running additional academies. We will do those postings in the future, and those that are interested in joining this team will have the opportunity to submit their letters of interest and interview, and then complete the physical process to be able to go through CERT. Capital improvement. Big slide. Highlights are what we're going to pay the most attention to. So our roof replacement in the administration building begins officially tomorrow, the 13th. We'll begin with materials measurements that require the longest lead time so that we can complete this project on time. Our next phase will include the teardowns and construction, and anticipated completion is the first week of November 2024. What is not appearing on this slide is the amount of preparation and movement that had to happen in order to make this process possible. We cannot have anybody working in this space while active construction is going on. Even though the roofing company and agencies believe that they'll be able to do this with minor disruption, we don't want to risk any safety issues in the agency or anything happening to any of our employees while this project is ongoing. So we had to move our records, booking, central records, mail room, our disciplinary hearing officer, range master and armorer, education department, programs department, substance use and mental health department, our mental health and drug and alcohol liaisons, and a number of different agencies that partner with us who utilize some of the spaces within that building so that they can collect their materials and be able to provide services. Some of those agencies might be the intermediate unit. And so this took an enormous amount of organization, preparation, and flexibility and willingness from our staff to be able to be relocated during this project time period. It also took our IT department and our operations team building out areas, building cubicles, moving all of the equipment to make sure that there was the least amount of disruption as possible. And somehow they were able to accomplish this so that we could get this project moving. I do believe that it will be worth it in the end, but very significant amount that is not featured on this slide. And so an enormous thank you to everybody who made this possible. It's not easy. We all want these things to be better and different and done, but it does take quite a bit to get us there. In terms of our electronic security and surveillance project, we did have our pre-bid tours that were completed on August 7th and our virtual pre-bid meeting that was completed on August 9th. We are in that current stage of pre-qualification for interested bidders. All of this follows the Sunshine Act as well as the procurement laws. We are going to be observing a professional labor agreement that was negotiated with any of the vendors that do bid on this project. And so we will be going through the bidding process over the next couple of months. When we select the teams of individuals who will be doing the work, that will be public information as well. We are hopeful that construction for this project will start January of 25. We really hope. And it is anticipated to be 26 months of work to have this massive project completed. And while I didn't highlight it, we have discussed previously with the kitchen, some of the meals. We do currently have some equipment that's down, 2 Baxter ovens, 1 convection oven, and 1 fridge, but all should be repaired by tomorrow.
And before we move on, I just want to, and I realize this is going to be repetitive of comments of maybe before, but I want to thank again our workforce and those who are incarcerated and their families for their patience here, right? Like these 3 areas, when we talk about HVAC and the climate internally, we talk about the impact on the kitchen that will have in terms of food quality and consistency. And certainly when we talk about what's, listed sort of as an umbrella of the security and surveillance program, but it's really a lot more than that in terms of a lot of the sort of elements of the design of individual cell blocks. This is going to have an enormous impact. I really wish we could sort of hit a, go forward button and be at the end of this and to see the transformation it's going to have. But obviously we can't do that. And we have to go through this process in a way that's responsible to the taxpayer. This is an enormous amount of money that's being spent and it has to be done responsibly. But, it really, the process itself will be disruptive. And we have to, hope that our staff and the inmates will have some patience with the disruption that it'll cause. But it really is for a transformation in this facility. So we thank them again for their understanding.
In line with this, we'll move to the HVAC slide. While we're in a little bit of a relief period in terms of the environmental temperatures, we still have some work to do. So at the bottom of this slide, you can see all of the dates of anticipated completion for the current projects that are, failures within the HVAC system, and all are scheduled to be completed by the end of this week. That will meet the Unit 2 hallway, Unit 7 A and D, Unit 8 A and D, Unit 4 and 7 main hallway, Unit 9 hallway, and Unit 10 A and D. So all, again, should be completed by the end of this week, which we are grateful for. Though we'll wait with bated breath. I know this has also been said many times before. All of these units are well beyond their life cycle. We anticipate that they will continue to require emergency repairs until we do fully replace those. And that project has not yet been bid out. And that one too is anticipated to take approximately 2 years. So while we will be resolving these current issues, we anticipate more to come with similar response and action to make sure that we are addressing these needs.
Yeah, I'd just like to say that I think I appreciated all the information we got about temperatures, but there was nothing that we could do. And we would get the emails where you're taking the temperatures in the different areas, and I'd read them. What response could you give? Like, keep taking the temperatures and do it. I don't know how you handled it. Everybody in the whole facility, the workers, the corrections officers, the inmates, it just was really had to be so difficult during that heat wave. I just want you to know that I did appreciate getting that information. I'm glad that we're moving on the projects, and I like Councilman Madden said, I wish we could accelerate it and be at the end of it. I just want to say I just never knew what to say in response to just try and keep the fans going. And I appreciate our contractors that are doing what they can to scotch tape everything together. But it just had to be a tremendous challenge. I really don't know how you handled it. I know you did the best you could with what you have. And again, these are things that were no money was put into any of these things for so many years that we're left with all these conditions. So I know we're on it, and just echo what Chair Madden said about it. But again, I would get your emails. If I didn't answer, it's because I didn't know what I was supposed to say. But wow, like what a challenge. What a challenge. I hope it cools off. This nice weather, if we could just keep it.
It's been
That'll help.
relatively good this week, and we'll hope that we'll keep trending in that direction. I think that my expectation is never that I get a response from you guys, but that you always get the information that you need, and making sure that you know that we do have plans to address and do the best that we can with the resources that we have available to us. So we can't immediately solve anything, but that we are aware, we are taking action, and we are making sure that you are all advised as well.
This is Deb Love, and I would just like to echo what Ms. Phillips said. I agree with all the trouble that you have to deal with. Good job.
Thank you. My final slide for my portion of the presentation is our typical cost recovery items, of those that go deposited to the general fund, as well as those that are deposited to the inmate welfare fund. And I am happy to answer any questions that might be on your minds before passing it over to Deputy Warden Valley. Thank you.
Thank you, Warden Williams. Members of the Office Board, people online watching us. Thank you, Sean. As of July, our graduation rate, GED rate is 60%, which is extremely impressive. Thank you to all the GED teachers and the testers. The month of July, we completed our second module of motivation interviewing. I've talked about it last month when we finished our first model, which is a evidence-based practice to assist our case manager and our substance use counselor to engage effectively with our incarcerated population. 291 incarcerated person completed anger management as of July. 280 new PrEP enrollment, 330 IPs enrollment in NA and 198 in AA, and 85 IP completed CBT since we started it. We have some case management updates and some personnel change. I would like to welcome to George W. Hill Case Manager Watt. We're very excited to have you on board, and we have one departure. Our senior case manager supervisor, Mr. Swade, is leaving us next week. He has been with Joe Shelby Hill for 16 years, in which from 2006 to 2018, he went to another agency and returned 2021. During his journey over at Joe Shelby Hill, he wore several hats as a case manager and grievance coordinator. And during the transition, he also assisted with going through transition and attrition. He enhanced our relationship with Delco Adult Juvenile Services, and also he fostered the motivational interviewing in collaboration with Chester County. So, Mr. Swader, on behalf of the county, I really appreciate your services and good luck in your future endeavors. During the month of July, we interview internal and external candidates for his replacement, and I'd like to congratulate Mr. Hannigan. Mr. Hannigan is currently a case manager. He's been with Joe Shelby Hill for 30 years. He started his career as a correction officer and was promoted to sergeant lieutenant. He transferred to a non-security and worked in different departments such as IT and fire safety. He is currently our Unit 10 case manager and is providing case manager services to our severe mental health population, as well as our maximum classification population. And recently, he completed the CIT training in which the warden just mentioned. And congratulations, Mr. Hannigan, on your promotion. That's all the updates I have before I bring Program Administrator Kelly Shaw. Do you guys have any questions for me? Thank you. Program Administrator Kelly Shaw.
Good evening, members of the board and the public. Thank you for the opportunity to share program reentry updates. In typical fashion, I'll begin with our two grant-funded programs. The first step, Workforce Development Program, completed cohort 16 on August 1st. 9 participants signed up for the 4-week course and 4 successfully completed. August 5th, we began cohort 17. 9 participants signed up for the class. This group will be led by a new facilitator. EDSI, which is the agency who administers the class, onboarded Ms. Thomas. Ms. Thomas is familiar with the facility and the population as she served her social work internship with our medical department. We are enthusiastic to have her back in the facility and continue to have a positive impact on the population. Delaware County Reentry Program continues collaborating with clients on a weekly basis. To date, 19 individuals have been referred to the program. Of the referrals, 12 accepted services, 5 declined services, and 2 were released prior to the introductory session. Additionally, 1 participant has been released, and with the support of DCRP, he was able to gain employment, government assistance, and housing. DCRP partnership will continue over the next 20 months, and we are on track to meet the goal of providing extensive reentry service for 100 individuals. On display are additional program updates. Widener University facilitated 2 financial literacy workshops with 31 participants. Thresholds Decision-Making Program had 9 participants. Our reentry case manager engaged with 26 individuals providing community resources and discharge planning. Our drug and alcohol liaisons released 69 to inpatient treatment. Maternity Care Coalition provided personalized support to 6 women. And the Delaware County Veterans Department administered service to 4 veterans. Lastly, 441 courses were completed on the tablet. The electronic learning allows users to learn at their own pace while engaging in educational, vocational, and rehabilitative curriculum. Thank you. Can I answer any questions? Thank you.
Thanks, Michelle. All right, moving along to any new business from board members. If not, we'll move to, move on to public comment. Is there any public comment for today?
Kimberly Brown, Godwin. I'm deeply concerned about the lack of oversight care for inmates and employee safety at our jail. Despite attending monthly meetings, I've seen no discussion of the critical security measures by the warden or the 9-member oversight board. The warden mentioned about the major incident stabbing. It was more than just a stabbing, unresponsive IP and medical. The jail is old, deteriorating by seconds, continuing to waste tax dollars rather than focus on urgent capital improvements. We need to address the consistent extortion, stabbings, assault on inmates and correctional officers. Do anyone care? The ion scan at the prison has been broken since I started and finally died, putting everybody at risk at this time. Yet, no one pushes the issue of our severe officer shortage. It seems like there's 25 officers needed per shift. We're losing a senior case manager, and I hope we're not promoting the next case manager to be a senior case manager to pay him more money, which we could have gave the current senior case manager. Man, I'm begging you to prove me wrong. The jail is unsafe and is getting worse by the day. Please focus on the well-being of inmates and employees. We need change now. George Hill's a challenging workplace remain unfilled. These seats remain unfilled because of potential employee fear of retaliation. As long as I continue attending meetings, this meeting and county council meetings, my complaints will go unnoticed under the leadership of Laura K. Williams. Every time I go to HR, no, it never gets attention. I don't know what I'm talking about. Nothing gets done. So that's the retaliation I'm getting. It's fine. Because as long as they're building their case, I'm building my case as well, starting with discrimination of color. I'm here to let you guys know we need more help at the George W. Hill facility. I'm a county employee, but I don't get the county holidays. And the reason why I don't get the county holidays is the made-up rule at George W. Hill. Joanne Phillips, Deborah Love, the jail is still hot. It's only Tuesday. The temperatures at the jail fluctuate by the hour, by the second, by the minute. You need to come in and see what the facility is doing. Come around 1 o'clock during happy time in the jail to see what's going on, not when it's lock-in time. Thank you.
Any other public comments? All right, hearing none, we'll move on to board member comments. Anything further from today? From the board members virtually? If not, I will entertain a motion to adjourn.
Make a motion to adjourn.
Second.
Motion is second. All in favor?
Aye.
Any
Aye.
opposed? The ayes have it. We are adjourned.